Well, in this morning's Health Watch, more than 32 million Americans suffer from diabetes. That's more than 10% of the population.
Modern medicine can help patients manage their disease, but one clinic in Portland helps patients in another way, too. Foxville's Marilyn Deutsch explains in today's Health Watch.
Dr. Elizabeth Stevens has type 1 diabetes. Dietitian Maureen Sprague also has type 1 diabetes, and so does pharmacist Brianna Pattaccini. They all work here at the Providence Endocrinology and Diabetes Clinic East, treating both type 1 and type 2 diabetes. They treat with medicine, diet, consultation, and their personal perspectives.
Because I have the experience of living with diabetes.
Dr. Stevens says she puts that experience to use in her practice.
Diabetes impacts what you eat, it impacts how you are active, it impacts your work day. So if your blood sugars are high or low, it may impact how easy it is to get things done.
Fast, quick diets, don't work, and we have to be able to live with this, for a lifetime.
How you doing?
Dietitian Maureen Sprague also brings her hard-earned know-how to her patients. When she was first diagnosed, she was told, now you can't eat this or that anymore. That's a rule she breaks.
I'm never going to tell someone they can't have something. We're just going to talk about impact on blood sugar, and then often try to do some experiments with blood sugar testing and food.
Maureen helps patients figure out how they can still eat their favorite foods some of the time. Patients at the Providence Clinic also work with pharmacist Brianna Pattaccini.
There's a lot of tips and tricks that I may have that somebody without diabetes wouldn't necessarily know.
Dependent on insulin herself, she is personally aware of the high costs and the confusion with insurance. She's familiar, too, with the frustrations.
That feeling that diet and exercise could really fix diabetes and it can control diabetes no matter what. And it's not the case. And I find that it can be kind of a source of shame or guilt for some patients of feeling like they're not doing enough.
So we have to remember that it's never perfect. And so we're going to have blips, we're going to have highs, we're going to have lows, but we're going to try to minimize those.
Take it from those who put into their professional practices what they learn from their own personal trials. Marilyn Deutsch, Good Day, Oregon.